and share something. I'm going to read a letter that I'm going to share. Some people call it the world, some people call it the universe, to those that are interested and may need something like this, just to give you an idea of how to get started, and you can come up with your own letter. And so I was speaking to someone that I was speaking to someone and they are homeless. They have a history of substance abuse, and so they went to the emergency room.
In 2 miles, take exit 147AB on the right onto State Route 51 North towards State Route 202 Loop East.
They went to the emergency room that have their history in the chart. And so when she went to the emergency room, they went to the emergency room for a medical condition that was bothering them, something that could cause a serious infection, could possibly put them in the ICU or take their life, right? And so when they said they felt as though they were treated wrongly. And I said, so do they know that you're homeless? And she said, yes. So what happened was they tried to dismiss it like a Band-Aid a Band-Aid wound. And it's nothing. It's just something that you could put a Band-Aid on and be gone. Go on your way. And so she mentioned to them, she said, I'm pretty much aware, and I'm not leaving until you do a culture, and that's all I want. And so they was like, all right, that's all you want, we'll do that. Come to find out, the culture was positive. And so if she would have left, just thinking that it was a Band-Aid thing, like they dismissing you because they know of your background, your history of being homeless or on drugs. They can treat you as such. There's some people that will do that and dismiss you. So I came up with a letter and said, here's a couple of places you can start. If it makes you feel better, to submit it to the emergency room administrator, the hospital director, and you can also submit it to the mayor's office and Congress, so that they have to do because if you submit something to Congress, that organization would have to respond. I forgot the time limit now. It's been so long. I don't know if it's 48 or 72 hours with the reason of why they did what they did. And so here I'm going to read you a letter that you can use if you're ever in situations like that where people are devaluing you. And, sometimes people come into the emergency room and they act the damn fool and they need to be held accountable. But
Go past this exit, then use the right 2 lanes to take exit 147A, be on the right onto State Route 51
if you have legitimate
State Route 202
gripe
East.
Of something like seriously ill wrong with you medically or mentally, and you feel as though you're not treated
use the right,
here
2 lanes to take exit 147A.
So yeah, people make it hard when they don't like you, but it's not about making it hard for them. What it's about is protecting yourself and getting done what you need to get done and what you want to get done, and for yourself, to make yourself better. And so, like, some people may say, well, I don't want to get them fired. It's not about that. In some organizations, they listen and they bring out different policies to try to make things better. So if you keep that in mind when you're protecting yourself, trying to protect yourself, you can't worry about and beating yourself up because what somebody else think of you and how they treat you bad, And then also on another side of that would be when people will say, well, you're going to make it harder for us to document our wrongdoing. That's not what this is about. If you treat everybody the same, which you should be when you raise your hand to take care of people in customer service, you don't have to worry, but it's time for people to take care of themselves and look out for themselves. And that's all this is about. I'm just, handing a letter here where you can use and you can scrub it to your advantage and how you feel for different situations that is similar to this, which, it helps. And yeah, another thing is people say, well, I'm not saying nothing. Things will never change. Okay, if that's your perspective, things will never change, then fine. But understand, do you think the person that you're talking their ear off about it is going to make change for you? Is going to ingest that in their body and soul through their eardrums just to ingest it into their bodies and not, try to figure out a solution to try to help you or give you ideas, but you just want them to listen to you? I understand that part. Yes, we should listen and, have empathy, but to say you're not going to do anything about it and things will never change, and that may be so. Of course, there's always a foul 13, throw that shit in the trash, but it's worth a try. That's all I can say. And if you want it, here it is. Okay, here I'm going to read the letter that you can use and customize it, for your own self, for those that this interest can be of interest to or help. So up top, you'll put your name, your address, your city, state, your email address, your phone number, your date, blah, blah. And write different letters. One for the emergency room administrator. You can always Google and find out, the email address for that person, what the person's name is. Then you can do another one for the director, in this case for the director of the hospital, find out their name, email address, or the address. Same with Congress, same with the mayor's office, same with anything that you may want to submit for a complaint. And you can find their contact information online. So it starts here with Dear Emergency Room, administrator's name, director's name, and put the subject, formal complaint regarding emergency room treatment. So I am writing to formally express my dissatisfaction with the treatment I received during my recent visit to the emergency room at the hospital's name, the clinic's name, the urgent care's name, and you put the date of visit. I presented myself at your facility seeking medical attention for whatever the condition, complaint, or issue is. And then, unfortunately, my experience has raised serious concerns regarding the quality of care provided and the professionalism exhibited by your staff. Upon checking in, I was required to disclose that I am currently homeless. While I understand this information may be relevant for administrative purposes, it should not influence the level of care or attention given to any patient. However, it seemed that my situation was dismissed rather quickly by both the nurse and doctor who attended to me. They assessed my condition and concluded that it was merely whatever the condition was or issue or complaint was, that would heal over time. This assessment felt superficial and did not take into account my insistence on further investigation. Despite their initial dismissal, I clearly communicated my concern about the condition, issue, chief complaint, blah, 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 and requested whatever tests, cultures, imaging, to ensure there were no underlying infections or complications. After some back and forth discussion, they reluctantly agreed to perform whatever imaging, cultures, or tests, but appeared more focused on expediting my discharge than addressing my health needs comprehensively. To my dismay, I received a call from your hospital today informing me that these tests, cultures, whatever, results, whatever fits you, were positive for diagnosis, infection, disease, blah, blah, blah. This news is alarming and underscores the inadequacy of the initial evaluation I received during my visit. It is troubling that had I not insisted on further testing, a potentially serious condition could have gone untreated. I believe it is crucial for healthcare providers to treat all patients with respect and thoroughness, regardless of their socioeconomic status. The lack of proper evaluation in this instance not only jeopardized my health, but also reflects poorly on your institution's commitment to patient care. I urge you to review this incident thoroughly and consider implementing measures that ensure all patients receive appropriate evaluations without bias or haste. It is essential for healthcare professionals to listen actively to their patients' concerns and provide adequate care based on those concerns. Thank you for taking the time to address this matter seriously. I look forward to your prompt response regarding how you plan to rectify the issues within your emergency department, your primary care department, your neurology, or whatever department you were in. And they put sincerely in your name. So this way, if you were felt wrong and you were felt devalued, this is an example of something that you can submit on your behalf to get some type of response or no response, but you've done your part to speak up, and that is having your voice. Peace.